Hello, everybody. This is Dr. Newmark, and we have our video here today. Oops, for our keeps going forward. All right, sorry about that. False start. Okay, so we have our video today for week 12. I'm sorry for my delay in completing this video. I had started it last Wednesday, and then I went to this conference, and I thought I was going to finish it Wednesday night and post it, but that did not happen. So my apologies, but here we are. Okay, so the first article is actually one that I co-authored with two colleagues. One is Sunny Klatsches-Chiligi and the other is Joe Bartolotta. Sunny received her PhD about a year ago from UNM. Some of you may know her. So I'm just going to read these two quotes and I'm going to talk about these ideas a little bit more. So this work is multivocal and decenters Euro-American ontologies about scientific and health communication. This work is dialogic with the consistent voice of our lead author, journalist and rhetoric and writing scholar, Sunny R. Klatsches-Chiligi, reminding readers of the storying nature of all of our work. This chapter decenters the dominant concepts of scientific communication that have embedded within them colonial practices and histories that have strived to reify rationality, methodologies of individualized medicine, and discourses that separate humans from the social and cultural networks that connect them to the non-human forces that have long supported community well-being. Sorry, I have an extra hyphen in there, but so the goal with this article that we wrote was to foreground the ways in which DNA people themselves communicated information surrounding health safety in the early months of COVID. And the examples in the chapter show some of those images and graphics that were used within the community. So as the articles that I'm going to discuss later on in this presentation convey, community-centered communication is vital. But this book that our chapter was a part of, and let's see if I can pull it into the screen here, is called Global Rhetorics of Science. And our chapter was one among many chapters that came from all over the world that talked about how there shouldn't be this monolithic sense of scientific and health communication. It needs to be very community-centered in order to move publics in those spaces to adopt practices that will save lives in the case of COVID. So I was able to include in this presentation the color versions of the images that are in the article that you saw in black and white. So our intention, as we state at the end of the article, has been to destabilize and push to the margins Euro-American approaches to analyzing scientific communication, particularly concerning virus mitigation communications in Indian country. We have done so by working to expand and diversify rather than reduce and simplify the stories told about COVID-19, excuse me, health communication in and around the Navajo Nation. So if you read the article, which I assume you did, you learned about the folks who generated these images and sort of the visual rhetorical principles, if we're going to apply that term to these, that are in play in their construction, and how some of the images and symbolism were particularly designed to resonate with a certain population. I don't have time to really tease together all of the interconnected themes across all of the readings this week, but I hope if you look at things like storytelling, plain language communication, metaphorical use of terms that resonate with certain audiences, that you can see all of those concepts at play in this article and as touching upon themes from the other items. Okay, so we're going to turn to this article by, can't remember the first name of the author, by Angeli. I think this was written in a graduate class of Rick Johnson Sheehan's at Purdue University. He's very well established and well regarded in health communication. I've known him for a very long time. He actually authors the book that we use in our technical writing for curriculum class. So there were actually a lot of typos in this article, which I was surprised to see in a publication, but nevertheless, I think Angeli conveys some really interesting ideas about metaphor. I'm just going to try to go through this pretty quickly, but she refers to Susan Sontag with regard to metaphor and audience, and to Backy, I don't know how to say that, with regard to metaphor and context. How are these different? Metaphor and audience, metaphor and context. Medical and health writers, she writes, and professionals often speak in metaphor to convey information to non-experts. Can you think of or seek out examples of this? So she brings in comparisons to the 1918-1919 Spanish flu and the US government's downplaying of its danger because of the belief that worrying kills more people than disease. And Jelly associates this with the US. At the time, they had 2 peaks in this flu, and Europe had 1. And in Europe, the flu was openly discussed, as were its effects. So fear-based metaphors, war-based metaphors, and disaster metaphors are commonly used. So since this article was written before COVID, I'm sure there are many robust studies. In fact, I'm going to show an image related to one here in a second that speak to some of the metaphors that were used related to COVID communication. So here I have an image on the screen of this book called Metaphors of Coronavirus, Invisible Enemy, or Zombie Apocalypse. You can look for this book if you are interested. So names intended to evoke emotions, such as swine flu, often include metaphors that blame and instill fear. Names intended to refer to the technical nature of pandemic flu, such as H1N1, often include metaphors that show officials have no control over the flu, as flu is just a scientific force of nature. These responses shape whether the citizenry responds with fear, blame, or acceptance. In this article, there wasn't really a study of sort of like categories of media communicators. I mean, there was a little bit between nations, but within a nation like ours, where we have very polarized media entities who tend to communicate perhaps some information in very different fashions, it would be interesting to track the kinds of metaphors per her categories that are used by various types of media entities. So Angeli calls for more logos-driven media messages, or at least for consumers of information to understand the metaphors in health communication with more reason used, so logos-driven. I'm not quite sure how to move the dial there without like a wholesale education overhaul, but maybe you can think about this question I am very curious about your insights into the takeaways from Angeli's work and how you see metaphors in play in the health communication you consumed during COVID's peak. What are the actionable behaviors for communicators that Angeli espouses? Now we're going to move on to the third reading, which was, I loved this. I love this one from the journal Pharmaceutical Medicine. I thought it spoke very clearly about the value of plain language in healthcare communication. So in digital contexts, Power argued that communicators need to attend to issues of flexibility of access of information, shorter attention spans, and desire for more self-service and asynchronous interactions. That's what we want as consumers of healthcare information and of healthcare, with telehealth and the growth of that industry in recent years. So think of your own consumption of healthcare information, whether with your own doctor or just via Google searches. Do these needs align with your own? I have an image on the screen from an article called Human-Centered Visualization Technologies for Patient Monitoring Are the Future, a narrative review. And this shows an avatar being used to communicate health information. I can't go into all these things in great detail here because these videos are already so long, but food for thought. So Power believes that within medical teams, those charged with communication need to be upskilled to communicate more effectively in a virtual world. I mean, that kind of upskilling is learning a vast array of new discourse practices and tools, technologies, techniques. I'm wondering how this is operationalized in healthcare systems. So what do you think of the call for more standalone healthcare information that does not require a live voiceover? It's great to have a knowledgeable physician nearby explaining something to you, but how feasible is that? And is there a real disjuncture between their rhetorical capacities and your comprehension capacity? So standalone information that is comprehensible seems to be advantageous to me. So other compelling ideas are these: more bite-sized information that can be consumed on the go on a mobile technology. And Power says that biopharma has historically used a push model of communication and now needs to adopt a pull model. What does this mean? And how does this shift maybe power dynamics? So I love this comment about plain language summaries. What a PLS looks like is only constrained by limited thinking. They can take written, spoken, and visual forms in any channel, medium, or format that best meets patient needs. So targeting information for stakeholder needs is precision communication. Absolutely. I want to know what that looks like. I'd love to hear from you all with some examples. So the fact that power, that I didn't capitalize there, sorry for all my own typos here. I always catch them when I do these videos. Power calls for effective use of storytelling. Now this is music to a writing teacher's ears. I'm always telling my biology students not to forget about storytelling. So storytelling can help patients to focus, and it can get key points across and ensure that information is compelling and can stand alone. Power also calls for a move away from words and numbers. What does this look like? Well, more images, more data visualization, and minimal text. Complex information can be communicated concisely and in different formats. Two key concepts end this article. One concerns the multi-channel approach, and one in which the provider becomes an information concierge. What do you take these to mean? So finally, power closes with this. The stakeholder, not the technology, determines the optimal means of delivering information. Yes, I absolutely agree with that. Now, finally, the last thing is this 14-year-old report, the National Action Plan to Improve Health Literacy. So it's impressive that this plan exists. I didn't see a more recent one. Maybe I missed it, but this one, as I said, is 14 years old. I wonder if it's made any impacts. So the greatest opportunities for reducing health disparities are in empowering individuals and changing the health system to meet their needs. That is a pretty big call. So with regard to communication, we are in a dire situation concerning levels of health literacy. What are some of the impacts of low health literacy? I love the mention of user-centered design, and particularly participatory design in developing communication products. Those would be scenarios in which the users are actually involved in various iterations and revisions of a certain communication output. They would participate in its design and then test it and then revise it and then test it again and keep going through that process until it meets the needs of the community. There are clear resonances here of universal design because it is impossible to tell by looking who is affected by limited health literacy. Same with universal design for learning. You don't always know a student's learning needs, but if you design with the needs of all students in mind, then it's going to serve all students, not just those with a specific need. So among the 6 principles for improving health literacy is a call to document the short and long-term effects of efforts to improve health literacy whenever possible. What do you think this might look like, this kind of documenting of these efforts? So in fact, not abiding by principles of clear communication of health information attuned to the fact that there are so many people who possess low health literacy is itself a healthcare crisis, and that an inability to understand medical information or product labels, manuals, package inserts, and nutrition labels can harm individuals in various degrees of severity. So this sort of begs the question of what role might technical communicators play in this intersection space between medical communication and technical communication. You know, there are medical writers, medical editors who exist out there. That relates to the unit that we are in the middle of right now. But so many of the things from this week's readings resonate with the exact skills that we teach in technical communication. So I hope the readings were interesting to you this week, and I look forward to reading what you have to say in the discussion board. Have a great rest of your day, and I'm going to stop the recording right now. Have a great day.